So how do you deal with a client who knows what they want, but you don't feel the treatment is right for them? This is a fantastic question. It's kind of what a good clinician has to deal with all the time. We're always trying to match our treatment to expectations. And it starts with really understanding what they mean. So when a client says they want 3 mils, they don't really want 3 mils. What they want is a result. And what you need to get back to is exploring the result. And it's essentially back to the fundamentals of a good consultation. What are they hoping to feel afterwards? How are they hoping to look afterwards? And what is the treatment that they think will actually deliver them that result? Because in those 3 sets of beliefs are all sorts of things that they may get wrong. And this is, in general practice, we call this exploring the health beliefs. You're trying to reach into their mind and understand how they've reached their conclusions and check their thinking, because after all, they may be an expert in lots of ways compared with you because they're an expert on themselves, but probably you're the expert on what 3 mils is going to do for them. You're probably also the expert on what real beauty is. So there are various ways that you might need to adjust their beliefs, or at least communicate them more thoroughly before just delivering them 3 mils. So I call it the vending machine approach if you just do exactly what your client says. And it's a recipe for dissatisfaction for you especially. So it's really important to get back to the fundamentals. What are they hoping to look like? Do you think that's really going to work? If you're unsure, what I'd suggest you do is you negotiate a different route to those 3 mils. So you would say, I'm not sure that's really going to actually make you look good. You'd explain exactly why. So the ratio of your cheek to your jawline might be too strong. That might make your face too wide. Maybe it doesn't match the width of their eyes. Maybe it doesn't match the width of their mouth. There are all sorts of reasons why you might not want to do that. So I'm prepared to do maybe 1 mil, see what it looks like, and then we can do it together. Because the great thing with dermal fillers, you can see the result you're creating as you go along. As long as you've been clear around where the limits are and you've got a good reasoning and your patient accepts those limits, because really what you're looking for is a sensible patient who takes your advice, then you can do that in stages. What I would say is a contraindication for treatment is if the patient doesn't accept your advice at all. If they get into the position where they're saying, you just need to do what I want you to do without any negotiation, you can't trust that patient. And I always say, trust works both ways with patients. I think a lot of clinicians feel like we need to earn the trust of our patients, but actually you need to trust your patient too, which means you trust them to work with you to get to achieve a goal that you both are happy with. Because it's no good for a clinician if you're not happy with the work you produce. And I think it's a fundamental thing you need to get right, is make sure you're happy with the work you're producing and that you have a patient who agrees with that you're working together to achieve a common goal. If you have different goals, you'll never be happy. So it basically boils down to a consultation where you are unified in your goal instead of having different approaches or different goals to the same, for the same treatments.